Allow me to introduce Practice Management Associates with Lynn Nelson and Donna Lowell. Let's join them now in discussion.
Hey, everybody. We decided we're going to talk today about another very frequently asked question when dealing with a dental transition, and that is
to tell or not to tell.
Everybody they hate that they can't tell anybody, and they really hate that they can't tell their staff. Understandably, it feels deceptive, and it's just not a good feeling.
No, it's not.
But there are some very, 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 very good reasons not to do so.
And everybody has a different take on this. Some offices actually do tell ahead of time. They just absolutely can't live with that decision to not tell them. We always go into it with, it's your practice, it's your baby, you get to do what you want to do. I will, however, tell you that when you do tell the staff, depending on who they are and what kind of relationships you have, it is very anxiety producing because not only are they losing a boss that they love, they don't know who's coming in, and it could take 6 months, 9 months, who knows, depending on where your practice is located. It could take a while to sell that practice, and so that's a lot of time to live with that anxiety. So in my opinion, the best thing is to keep it under wraps in the beginning and tell them later when you have somebody for them to meet. However, some like to just get it right out there and let them know. If you are in that camp where you want to let your staff know, there's certain parameters in which you need to operate around that. The staff can know, but the patient base really should not know. And the reason for that is the patients are, by and large, the biggest piece of the goodwill of that practice and the value of that practice. And you start telling patients that, and they will start looking around and thinking, oh, I remember Julie told me about her great dentist. Maybe I'll try him since mine's retiring. So you don't want to lose your patient base. So the patients really should not be informed until you have a letter ready to go out to introduce them and to pass off that goodwill to your buyer. As far as the staff goes, if you want to tell your staff ahead of time, that needs to be first and foremost, that nobody in the dental community needs to know about this. I'm telling you this because I trust you, I care about you, and I don't want you to feel as though you didn't know what was happening. Again, not my favorite scenario, but
the thing about the risk there, from my perspective, is how easy it is to slip and how easy it is to tell the Patterson rep that the dentist is going to retire. And then that gets around easily. I mean, it's not intentional, but it's a lot to ask people, particularly when you don't have any idea how long it's going to be before the transition occurs. And I think that usually our sellers are okay with waiting until we have a letter of intent and somebody that we can introduce the staff to. Most of the time they see the logic in that. In the occasion when, we had a practice where the staff was told quite early, actually, but the staff loved each other and they loved their patients. They loved where they worked and came to the conclusion that the only person that was going to be gone was the dentist and that they were all on board with whoever ended up coming. So, it can work. It just depends on the dynamic of the practice and the dynamic of the staff. I mean, really, that's huge because another reason to leave, if you don't really like the staff that you work with and you find out that the dentist is leaving, you might as well start looking for a job. And you might have 6 months to find that job. But
and the thing about it is it's not like when you find the buyer and the buyer says, okay, I want to put a letter of intent on the practice. And let's say we have 2 or 3 letters of intent that we're submitting to the doctor. Now the doctor's going and he's meeting with individuals, or she is meeting with individuals who want to buy their practice. And ultimately, it's their decision who they pick. We can put somebody in second position. We recently had one in third position. But, we can do that, and then you have your buyer and the letter of intent is signed. That's when the work begins. Believe it or not, there's a lot more negotiations that go on within that. We have a boilerplate letter of intent that we use. It's based on, the standards in the industry and all of that. But you put, a professional accountant, a professional attorney that are used to working in this arena, and they have some ideas that they want to share, which rightfully so, they should. But the problem is, you have a lot of time between letter of intent to closing. And there's a lot of boxes that still need to be checked. And so if you tell your staff too early, even if you know who that is, what if it fell apart? Then you'd have to introduce them to somebody else again. And so our suggestion is that you get through the purchase and sale document piece of it. You go back and forth.
Lease agreement, if it's going to be a lease.
Absolutely, because the lease will hold it up more than anything, especially if you have if you're dealing with a property manager. That's even, I don't know if you remember that one. That was tough. But so there's just so much more to work through before you can really say, this is my buyer. Hopefully it's your buyer, and hopefully we get through everything. If you're working with somebody that's good at communicating and acting as a liaison between the professionals, it 9 times out of 10, it does all come together. But you don't want to take that chance and introduce them to somebody who doesn't end up, signing on the dotted line. So I always say wait until maybe a week, 2 weeks before the transition actually is set to occur. That gives the staff enough time to get used to it. You're not telling anybody too soon, especially the patients, because they're all going to want to come in and see you before you leave. And that's not always the best idea because you can't see all your patient base before you leave. So if you wait and tell the staff around 1 to 2 weeks prior, and we always say introduce the staff, and then within 24, 48 hours max, introduce your buyer. And usually we suggest a social situation. It can be as casual as have pizza at the office, or if you want to take them out to dinner, whatever you want to do, whatever works. But that's the best way to handle it, because then by that time, the purchase and sale documents have been agreed upon. You've got a lease in place. You've got lending in place. You've got insurance. He's got his life insurance, disability insurance, all of those things. And we're just waiting for the target date to close. So I think that is by far the best way to do it in my mind.
I agree. It's the least anxiety provoking. And we often go and tell the staff with the dentist.
Oh, that's right.
Because some of them just don't feel like they can do it. And then we go when the introduction is made.
How did that go? You just did one of those.
Yeah, it went great. It was fun to watch the change in body language when they met the buyer. The night before, when the staff was told by the dentist, it was pretty emotional, and as it would be expected to be.
You were there.
Yeah. Mm-hmm. And it went fine. I mean, they were not, obviously they were very sad, but also excited for the stage of
they were a close-knit group,
very close to the seller. And then the next day, when we introduced the buyer, you could see the tension drain from the staff when they met this young man, because he is just going to do great. He's going to be a great boss. He is so excited about being in this practice, and it was just very fun to watch their concerns float away.
That's nice.
Yeah, it was nice. That's fun. It's a fun part of the job.
Well, have we ever been involved in a meeting where it wasn't? I'm trying to think back on the transitions we've seen. I don't think that I've ever really been involved in one that didn't go pretty well.
I can't think of one. I've heard some horror stories where the staff walks out, but we've never experienced that.
Yeah, don't you think though that has a lot to do with planning?
Yeah, I was just going to say, I think because we're careful about who we work with, and we don't work with everybody.
Well, and I think too, just the fact that we plan for it.
We're guides, and do a lot of coaching along the way. And so no, we haven't ever had that never actually, where anybody had a fit. Yet.
Yeah, that's good.
Ooh, that was not good.
Knock on wood.
Yeah, for sure. Well, I don't know. Are we out of time? Oh, it looks like we are. Golly.
Well, it was great to talk with you about this topic, and it's definitely one that I'm sure there's some docs out there that will appreciate it.
If you liked this broadcast, please like us and follow us. You can find us on Facebook, LinkedIn. Our website is www.practicemanagementassociates.org. Call us, email us. Our email address is info@pmaadvisors.org. We'd love to hear from you. Mm-hmm. Thank you so much for listening.
Mm-hmm.
Have a great day.
Time. Bye.